Well, there's been a lot of attention in the last 2 or 3 years around claims that sweeteners can adversely affect human health via the impact of the sweeteners on the gut microbiota. So it's kind of riding the wave of interest currently on gut microbiota, which is supposed to affect every aspect of our health. But on current evidence, I think that this could be described as a major myth in terms of low-calorie sweeteners and microbiota. The claim is based in part on evidence that differences in microbiota composition are associated with common diseases and disorders. The ones that are most relevant are obesity, type 2 diabetes, and metabolic syndrome. And actually, there's quite a lot of evidence for this. If you compare, it comes from comparing, say, lean individuals with obese individuals, look at their microbiota, looking at type 2 diabetics versus control healthy subjects, and they do show differences between these groups. But there are a number of limitations and caveats to this sort of data. First of all, we don't know whether the association is causal. It may be that having type 2 diabetes and obesity alters the microbiota. Also, very importantly, there's not much consistency between the studies in terms of the types of bacteria involved at the species level, the genus level, even at the phylum level. Some of the early studies were showing big differences between obese people and lean people in what was called the Firmicutes and Bacteroidetes ratio, which are the two main phylums in the gut. But then subsequent studies, about 20 studies altogether, subsequent studies showed either the opposite effect or no effect at all. So currently, it's not really considered possible to use changes in the microbiota composition to predict risk of diseases like obesity and type 2 diabetes. But of course, that hasn't stopped people from doing it, doing this. People enjoy this, in part because it's gotten a lot easier to do microbiota studies using molecular technology. And sweeteners have been one of the things that people have been very interested to see whether they change the microbiota. And there are a lot of studies now on sweeteners, and they've actually been going on for some time. I did some in the 1980s, going right back, God knows how many years. But most of the studies have been done on animals, and usually with high doses and often very inadequate controls. And they do show effects. Usually they're modest. But again, as with most of these microbiota studies, there's no consistency between studies. So there's been like 4 studies on sucralose in rats and mice, and changes were different in each study. So it's very difficult to to deduce anything from that. And actually, in fact, some of the changes you might consider to be beneficial, some of the differences in the microbiota. There have been human studies, but and these are going to be more useful than animal studies in many ways, but there aren't very many of them. And most of them show just minor effects. And some of the recent ones on aspartame and sucralose show no effect at all on the microbiota. But these human studies, unfortunately, all of them are relatively small studies, often no placebo control, no dietary control. We know dietary control is really important for looking at these studies because diet has a major impact on the microflora and can confound the study. So it is a myth. Overall, I think most changes in microbiota are small, inconsistent, and so the current evidence, which is somewhat limited, doesn't support that adverse effects on human health are due to sweeteners affecting the microbiota. I think it is, you're right, still relatively chaotic. There's clearly the amounts of data that you get are huge from these studies where they're using sequencing methods for analyzing the microbiota. There seems to be as well an obsession with counting the bacteria. And I don't personally feel that's the best way to go, but it is possible. It's relatively easy to do now, so people just do it. It doesn't take long to do, so you can add it into the experiments. But they're very, very difficult to interpret, these studies, and most of the studies don't show any consistency. And I think what we need to do, and it's starting to happen a lot more now, is looking at functional changes in the microbiota. And these could be very different because you might have the same lots of different bacteria, but they may have the same function. So you may see changes, but it may not mean anything in terms of the effect in the gut. So there's a lot of interest now looking at metabolites, proteins produced by the gut bacteria, and seeing how they may relate to health and disease. I think at the moment it's very difficult. I mean, there's certainly in animals you do see effects, and that's because usually you can give quite high doses. In humans, we're not really seeing many. The effects are modest, and it's very difficult to say that there's any clinical significance there. So I think the problem with the animal studies is that we know that the animal microbiota is very different from the human microbiota, so it makes it very difficult to interpret and extrapolate to humans. So I think at the moment, situation is, yes, we do see changes in animals, and there may be some modest change in humans, but at the moment we don't, there's no evidence that that has adverse effects. Well, they haven't, unfortunately, with they haven't all been compared in the same experiment. I mean, really, one of the problems with doing microbiota studies is that there are lots of different methodologies. You can use sequencing, you can use 16S RNA analysis. There's lots of different ways of doing it, and they all give somewhat different results. They can give different results. So really, nobody's actually compared all the sweeteners together to see whether there are any differences. And of course, the focus has been saccharin because it's the oldest one, and it's been over periods of time. That's the one that's been looked at most. And sucralose seems to engender a lot of interest, possibly because it's an artificial sweetener. Interestingly, stevia glycosides have not been studied very much, and I'd have thought, personally, that was the one that would have an effect on the microbiota, because we know it goes down to the colon, and we know that they are metabolized by the gut bacteria. So you would imagine that there may be some effects on the microbiota, but we haven't looked at that. Possibly because it's a natural sweetener, therefore it's completely harmless.